Hi there. My name is Dr. Paul Simon. I'm a psychiatrist in private practice. I see a wide range of clinical situations. Please like and subscribe to this channel if you find it useful or interesting. I wanted to do this video on trauma and PTSD. So there is a wide range of trauma and related conditions that I see in my practice. Everything from the most severe um, military trauma to psychic trauma, if you will, with the results of emotional and verbal abuse from childhood accumulating over time, not involving physical or life-threatening trauma, sexual trauma, or religious trauma even, such as abusive spiritual directors and things like that. So I see a wide range of situations. Now, the most commonly known condition relating to trauma is post-traumatic stress disorder. Now, this was first noticed or defined after World War I and World War II, where the phenomenon of being shell-shocked occurred. So basically, it's where your body experiences acutely or immediately life-threatening situations. Where your fight or flight response is just overwhelmed. And it leaves almost a scar in a way in the brain, not physical scarring, but it's such a potent situation that reacts to your chemistry and it just sticks. Now, it must be said that not everybody who experiences trauma experiences it the same way. Now, some people who experience severe life-threatening trauma will develop PTSD, but most won't. So there was a big study, for example, back years ago with the Oklahoma City federal bombing, where there was a truck bomb and blew up a building, and a lot of people died, but a lot of people survived, and they studied how likely the people were to develop PTSD. And they found about 7 to 10% of people developed PTSD after that. Now, PTSD stands for post-traumatic stress disorder, is different, again, than accumulated trauma from emotional abuse, verbal abuse, that kind of thing. So PTSD is more visceral or physical to a lot of people than emotional or anxiety. So with the PTSD, when there's a physically life-threatening situation, it makes sense that the effects of it would tend to be more physical, right? So watching your back, safety concerns, easily startled, being jumpy, and always watching your back, always knowing where the door is and having an escape plan, for example, or sometimes flashbacks or intrusive recollections of significant trauma, nightmares. So that's kind of more of a classic definition of PTSD. We'll talk about treatment in a little bit, but more commonly what I see is trauma from emotional abuse or verbal abuse, particularly from childhood. So for instance, if somebody is raised in a very harsh or strict or pressured environment growing up, they will internalize a lot of that. I mean, naturally, we all internalize our environment growing up, our upbringing from parents and whoever we were around, for better or worse. So if we're always being criticized and attacked verbally or called names, you can consider that a form of trauma, if you will, and that can stick. Now, one of the features of trauma that can lead to PTSD or PTSD light, I like to call it, where it's not formally PTSD, but it's trauma-related effects over the years, is if the person cannot escape their trauma, okay? So, for instance, in an explosion or a violent assault, you obviously can't escape that, or else you wouldn't have been a victim to it. But if you're a kid and you're being berated all the time, or there's domestic violence in the house, maybe to a parent, or between spouses, or mom's boyfriend or something like that, and you can't escape because you're a kid, even though it's not directly directed at you, you can't escape it. So that inability to escape can really make it stick more, because what do you do then? Well, people learn in a way to be helpless, or that they are helpless in certain situations. Sometimes people will disassociate. So what I mean by that is they will go to their happy place in a way. Now I say happy place in quotes because it's not always a happy place. It's just somewhere else. Maybe they'll shut down or black out, or they may not remember looking back on it. There's some disconnect of consciousness where they don't have an awareness of their circumstances at that time, or they just block it out, not even consciously, but maybe even subconsciously, because it's so traumatic that they don't want to, or they can't process that. Or it's more like if let's say somebody gets shot or they get stabbed or something, and there's a bullet in their body. Well, if the body can't expel that, then what does the body do? It will actually scar over and make an encasement or a scar around that bullet, to try to protect the rest of the body from it. Similarly, if we have a trauma that goes into our mind, our consciousness, it sometimes will be encased in scar tissue, impenetrable tissue, in a way, or impenetrable kind of level of consciousness, to kind of cordon it off to protect the rest of us and help us just get through our days. So our body and our minds have these amazing abilities to protect ourselves, or block the rest of our body and mind from traumatic physical objects and traumatic experiences. Now, one other phenomenon that I see a lot with trauma is when somebody comes to me in middle age, or when they're an adult, after having experienced a traumatic childhood, or a traumatic relationship, domestic violence, or something like that. So a common scenario is, let's say, a 40-year-old woman who's suffering from a lot of anxiety or PTSD-like symptoms, maybe some depression, and they come to me and say, well, my life is great. I have a good job. I divorced my domestically violent partner years ago, and I should be doing well, but I'm not. I'm a mess. And I don't know why. It doesn't make sense to me. Well, how I think about that is consistent with therapists and stuff that I've talked to, is that after somebody escapes or is able to leave a traumatic environment, it'd be a childhood or relationship or military or something like that, that's often when the effects will be seen. So somebody, if they're in an abusive situation, or they're in poverty, or there's a crisis where they just can't ignore, it's a factor of survival, they will be just in survival mode, and their brain and body will kind of cordon off the trauma, because it's just, they're just trying to survive and get through their day. It's only when the person has a little bit of wiggle room and security that things catch up to them. And that's when your body and mind are almost telling you it's okay, you can handle it, you can face this, and you can process it. So it may be years later, after somebody escapes their trauma, that they're actually forced to deal with it on a deeper or more personal level, in a way. But again, just to emphasize, I think that that's the person's body and mind telling them that they're ready for that healing. So it's actually a good sign if a painful sign. Now, how to deal with trauma, it's never easy, obviously, but there are two main ways. So the main thing is like with therapy or counseling, all right? Now, God forbid somebody falls into self-medicating with drugs or alcohol, and that includes marijuana especially, because and a side note for marijuana, it basically stunts your emotional development. So it impedes or interferes with your brain's ability to process information, make new memories, and incorporate new information. So if you're trying to do therapy and turn over a new leaf and think about things different, if you're using a lot of marijuana products, it will block your ability to grow intellectually and physically and emotionally. So it's almost a waste of money to spend a whole lot of money on therapy and counseling if you're using a lot of marijuana products, because it'll just reduce its efficacy and your brain's ability to reprogram itself or whatever. So if you're using a lot of marijuana, it will block that growth, or at least inhibit it. It's almost like driving around with the parking brake on. If you've ever done that, maybe in one of those old cars, I'm dating myself here, but it just slows you down. It's like, why am I not accelerating here? Why am I not going fast? And what's that funny smell? It's like parking brake. Okay. So if somebody ends up self-medicating a lot because of the trauma and stuff, you have to get that out of the way first, really. And you can have post-traumatic stress disorder and depression, or bipolar, or ADHD. PTSD does not preclude other conditions that require treatment. Somebody's sleep habits are terrible, or whatever, they have health issues or diabetes or something like that. Those things have to be addressed as well. So it can be complicated. Now, as far as how to treat PTSD, there's counseling and there's medications. Now, counseling and therapy, the trick with that is to first find somebody that you're comfortable with. But secondly, make sure or be sure that the person follows your lead, okay? When somebody has had a lot of trauma, it is essential that they feel like they're in control of the situation, because it makes sense, they weren't in control of their trauma, by nature, by the nature of the trauma, they weren't in control of that. So it really is important that they feel like they're in control of the intervention. So working with a therapist, people are often scared of dealing with the trauma. They don't want to open it up, that can of worms, which is a legitimate concern. I get it. Now, that said, a therapist will want to have a basic idea of what happened, like what was the nature of the trauma. Now, I'm not a therapist, okay? I work mostly with medications, but I need to know what happened, basically. So I'll ask for, very limited, if any, details about things, just so that, the person's comfortable and follow their lead. So a therapist may need to kind of open that up some and try to work on that. But one way to look at that is, let's say you injure your shoulder, okay, in a football injury, or, I don't know, you fall off a bar stool or something. Injure your shoulder and it's broken and it needs surgery. Okay, so you get the surgery, and let's say you're 20 years old or something like that. But years later, that shoulder starts to bother you again. Maybe you're 40, 50 years old. Oh, that shoulder, and you go to an orthopedic surgeon and say, oh, well, we're going to have to do surgery again. It's out of place, or it kind of got messed up. So sometimes with an injury, even though it was scarred over or whatever, sometimes you have to do surgery again, to, fix it again. So same thing with therapy or counseling. Sometimes you have to go back and open it up a little bit and maybe redo it. Now, that's not always the case. You don't have to go real deep into stuff. but sometimes you do. But again, it's important for the therapist to follow your lead, and not force you to go places you don't want to go. Okay. So the key with that is communication. I see a lot of people who ghost their therapist because, I didn't want to talk about that. It's like, well, you got so far, you don't want to give up on it, So what I tell people is to, if nothing else, write their therapist a little letter or a note, send them an email saying what happens. I'm really uncomfortable talking about this in detail, or, I understand I need to work on this, but I'm not ready to. And so please, if we can work on other stuff or work around it, maybe we can come back to that some other time. So communication, giving that feedback is important. Okay. So communicate with your therapist. They can't read minds. Therapists cannot read minds. Psychiatrists cannot read your mind. You have to communicate with them, give them feedback, and some people are good at giving feedback. Other people are not, that's okay. Especially if there's trauma of a verbal abusive nature, you're probably not going to be really good at pushing back and saying, oh, no, don't do that. Right. Because it didn't work before. Why would it work now? So, but it is important to give that feedback, if they're going too far, too fast. Okay. Now, as far as medications for PTSD and trauma-related illnesses or conditions or whatever are considered an anxiety disorder. Okay. Now, again, you can have bipolar or schizophrenia or with PTSD and trauma, of course. And one increases your chances of having the other. So it can be a little bit tricky. But if it's just PTSD, you treat it like an anxiety disorder. And the mainstay of treatment for anxiety disorders is antidepressants. Okay. Now, we call them antidepressants because was their first use. That's, what they first were labeled as. But SSRIs, SNRIs, so those would be like Prozac, Lexapro, Celexa, Cymbalta, Effexor, Luvox, Paxil, all those medications. Those are the mainstay of treatment for PTSD and anxiety disorders. Yes, they are also antidepressants, but they are mainstay of treatment for anxiety disorders as well, including PTSD. Now, sometimes we'll use a medication called prazosin or prazosin. Minipress is its brand name. It's actually a little blood pressure pill that can sometimes help suppress nightmares. So if you have a lot of bad nightmares, you wake up screaming, or you just wake up and you're freaking out, you don't know why. Okay, maybe you're having a nightmare about something, that happened, and it's like a recurrent thing, more than once a week, I'd say. Prazosin or prazosin is a good option. And it usually doesn't affect the blood pressure too much. It's not a real strong antihypertensive. So a prazosin is a good option. Sometimes for some people, it can really help suppress that REM, rapid eye movement. That's a part of our sleep where we dream. It's typically in the second half of our sleep cycle, or at night. So you're looking at let's say you go to bed at 10, you're looking at 2 to 6 in the morning. That's when we're dreaming a lot, and that's when nightmares often occur. So prazosin can be sometimes useful for that. So an SSRI like Prozac or something like that, and prazosin. Now, another medication that might be useful for people who have had trauma. So I'm thinking more like, let's say they get in a car accident or something like that, or a plane, situation. They go on a plane and they start freaking out. Is something called propranolol. So propranolol is a different kind of blood pressure pill, again, that mutes or suppresses our body's fight or flight reflex. So it puts a cap on how fast our heart rate starts going, or how shaky we get, or we get sweaty palms and all that kind of stuff. So let's say you have a car accident and you're freak out every time you get, you try to drive, and so it's really a problem. Sometimes you can take that ahead of time and it puts a cap on that, so you can kind of force yourself to push that envelope and get back to what you used to do, such as driving or going on a plane or something. So propranolol, 10 to 20 milligrams, can sometimes be a real lifesaver. Now, that's not going to help with the anxiety, like the mental anxiety part of it. It's not going to impair coordination, driving like a Xanax or something like that. You want to stay away from that kind of stuff, generally speaking. So propranolol can be useful to reduce your body's response to an exposure to a kind of a stressful thing. So sometimes we use it in performances, like somebody's giving a speech or different things. I did another video on that. So propranolol and prazosin and the SSRIs and SNRIs can be useful. So I think that's about it. That's all I can think of to share with you today. I hope this has been useful. Good luck in your healing journey. I wish you the best. And you take care. Bye-bye.